Hello everyone, welcome back to my channel. In this session, I will be dealing with the topic suprarenal gland or adrenal gland, the development of suprarenal gland or adrenal gland. Because many of you have asked me to do a session on this and again, this is again a very simple topic but again the most confusing one. So suprarenal gland or adrenal gland, as the word implies, suprarenal means, renal means kidney, so above the kidney. That is what is meant by suprarenal, or adrenal means, ad means near. So adrenal gland means near the kidney. So when we talk about suprarenal gland, you have to know the anatomy of suprarenal gland first of all. I'll be dealing with a session on the anatomy later. So suprarenal gland has got a cortex, outer cortex and an inner medulla. So outer cortex, you have again three layers for the outer cortex from periphery towards center. You have the zona glomerulosa, then you have zona fasciculata, then you have zona reticularis. So these three layers constitute the cortex and inner you have the medulla. So that is how you have to visualize about the suprarenal gland or adrenal gland. Now talking about the development of suprarenal gland, it is derived from two main sources. Okay, two main sources. So the first source is mesoderm, and the other one is neurectoderm. Okay, so mesoderm and neurectoderm. So these are the two sources from which you have the suprarenal gland developing. So mesoderm is actually giving rise to the cortex, and the neurectoderm, actually the neurectodermal cells are coming from the neural crest cells. So the neurectodermal cells are giving rise to the suprarenal medulla. So these 2 points you have to first keep in mind. So mesodermal and neurectodermal in origin. So the cortex derived from the mesoderm and medulla is derived from the neurectoderm. Now we will see one by one. So you have to imagine a fetal body. So roughly by the end of second month of intrauterine period, if you take a section of the fetal body anywhere between the level of T6 to T12 segments, spinal segments, T6 to T12 spinal segments, if you take a section, this will be how the fetal body will be looking like. So can you name the structures here? You have the neural tube here, you have the neural crest cells as two masses, neural crest cells. Then you have the dorsal mesentery which is suspending the primitive gut. The primitive gut is suspended by the dorsal mesentery. Then you have the coelomic epithelium lining the body cavity, and here you have the developing gonads. So before viewing this, I recommend you to see two sessions which I have done before, that is the development of intra-embryonic mesoderm as well as the development of gonads. So you will get a clear picture of what I am mentioning here. Okay, so you have the dorsal mesentery suspending the primitive gut, you have the developing gonads. So the region between the root of dorsal mesentery and the developing gonads, you have the coelomic epithelium here. In this region, there develops a ridge. Actually, this ridge is formed by the proliferation of the mesothelial cells of the coelomic epithelium, and it is again mesodermal in origin. So you have the ridge formed between the dorsal mesentery and the developing gonad. So this ridge is known as suprarenal ridge. Okay, so this ridge is known as suprarenal ridge. So at this point, you know, this is a section, cross section of the fetal body by the end of second month of intrauterine period, and anywhere between T6 to T12 spinal segments. So because this is the level at which you will be getting the suprarenal ridge formed. Okay, and you can see the neural tube with the neural crest cells formed as two masses. I will be telling about the detail later. And you can see the position of the developing suprarenal ridge. So what is suprarenal ridge? It is formed by the proliferation of the mesothelial cells lining the coelomic epithelium. You have the coelomic epithelium here and you have the cells here, right? So the coelomic epithelium, the cells, the mesothelial cells which are mesodermal in origin, will be proliferating to form the suprarenal ridge. Okay, now we are going to talk about the changes happening for the suprarenal ridge. So you can see that the gonad is here, you have the mesonephric artery here. Now I am going to talk about the development of cortex. Don't think about medulla now, I am just talking about the development of cortex. So I am just wiping it off so that you will get a clear view of the development of cortex. Okay, so here you have the ridge, the suprarenal ridge, and here you have the cells proliferating, like clusters of cells proliferating. Okay, so it is just proliferating, but this proliferation is actually disturbed by the formation or by the intrusion of two structures. Okay, so this proliferation is just bit disturbed due to the intrusion of two structures. The one structure we have already mentioned, that is the neural crest cells, isn't it? So the neural crest cells will be intruding into this proliferating mass, which is actually going to form the medulla of the suprarenal gland. Then the next structure which is disturbing the proliferation of cells is the formation of venous sinuses. Okay, so you have the venous sinuses within it. So again, the formation of venous sinuses will also disturb the proliferation of the mesodermal cells. At this point, what happens is, you can see the mesonephric artery here, isn't it? They will start invading the suprarenal ridge in a radial fashion in order to reach the venous sinuses. So this is what is meant by the radial fashion of arrangement of the mesonephric artery. So the mesonephric artery will try to reach the venous sinuses by invading the suprarenal ridge. That is, between the cells, they will try to invade the suprarenal ridge and reach the venous sinuses. So what happens, you have the mesonephric capillaries arranged in a radial fashion. So what happened to the cells within it? The cells within it will be actually sandwiched between the capillaries. Okay, the cells within it will be sandwiched between the capillaries. So this is what is happening to the cortex, the cells of the cortex which are derived from the mesoderm. So first we had the suprarenal ridge which was just proliferating, and the architecture of the proliferating cells are a bit disturbed by the invasion of two structures, that is one from the neural crest cell and the other one the venous sinuses. Simultaneously what happens is, you have the mesonephric artery invading to reach the venous sinuses in a radial fashion. Now the cells are arranged as cords and it is seen sandwiched between the mesonephric capillaries. Okay, so this is the view. Now what happens is, you can see a fibrous capsule formed around the proliferating mesodermal cells. So you can see the fibrous capsule formed with around the proliferating mesodermal cells, and this capsule is now actually including the cells from the neural crest cells. It is including the capillaries, the venous sinuses and the proliferating mesodermal cells. That is how the capsule of the suprarenal gland is formed. Now let's see in detail about the cortex. Okay, I am just wiping it off. Now we can see the development of cortex. So you can see the fibrous capsule here, then you can see the venous sinuses here, then you can see the capillaries invading to reach the venous sinuses. Then you can see the cells arranged like this, isn't it? You know how the suprarenal gland looks like. I'm just talking about the cortex. So as these cells reach towards the venous sinuses, they will be becoming eosinophilic. And the cells which are persisting at the periphery, they will be basophilic. Okay, so towards the venous sinuses we have eosinophilic cytoplasm filling the cells, whereas towards the periphery you have the basophilic cytoplasm filling the cells. So at birth, you call the cells with the eosinophilic cytoplasm as the fetal cortex. Okay, so this is actually the fetal cortex, and towards the periphery the basophilic cytoplasm is actually our definitive cortex. Okay, so definitive cortex at the periphery and the fetal cortex will be more towards the center or towards the medulla or towards the venous sinuses, and they will be eosinophilic. The cytoplasm will be eosinophilic. So this definitive cortex is actually giving rise to the outermost layer, that is the zona glomerulosa. Okay, zona glomerulosa. So at birth, you can see the suprarenal gland with cortex actually differentiated into two layers, the outer definitive cortex, or you can call it as the outermost layer, the zona glomerulosa, and the innermost fetal cortex. So can you judge the size of the suprarenal gland at birth? It is said that it is almost 1/3 of kidney, the size of kidney. So that means it is a bit larger compared to the adult suprarenal gland, right? So what happens to the suprarenal gland later? In course of time, by say they are around 2 weeks, after 2 weeks of birth, what happens is this fetal cortex will just degenerate. The fetal cortex, the innermost the cells filled with eosinophilic cytoplasm, that is the fetal cortex, it will just degenerate, and the remaining layers of the suprarenal cortex, that is the outermost we have the definitive cortex, that is zona glomerulosa. The next layer will be the zona fasciculata, and the innermost will be zona reticularis. Okay, so these two layers, the zona fasciculata and zona reticularis, will be actually formed from the definitive cortex, that is the zona glomerulosa, and the fetal cortex will be just diminishing or disappearing, and that is how the suprarenal gland, which was about 1/3 the size of kidney, is actually shrinking to form the adult size. Now by the age of puberty, the size of suprarenal gland is roughly 1/30th of the size of kidney. So that is actually the proportion of the size of the suprarenal gland. Now, so this is about the formation of suprarenal cortex. Now we will move on to the development of suprarenal medulla. So before moving on to suprarenal medulla, you should know what you mean by the neural crest cells. So you have the neural tube here. I will be taking in detail about the neural crest cell, the formation of neural crest cell and the derivatives later. But for the time being, I would like to mention some important points. You have the neural tube here, and we have already mentioned that the neural tube is formed from the ectoderm. Okay, by the formation of notochord, this will induce the ectoderm to form neuroectoderm, and from the neuroectoderm you have the neural tube formed. Okay, but some of the cells of the neuroectoderm, which are actually folding inwards to form the neural tube, won't be actually merging with the neural tube, but they will stay separately. Okay, so you have the ectoderm, the notochord will be inducing the ectoderm to form neuroectoderm, and this will actually fold inwards and will get separated to form the neural tube. Some of the cells which got infolded but not joined with the neural tube will be forming the neural crest cells. Okay. Later what happens is the neural crest cells will be splitting into two, and that is the primitive spinal ganglia, and it will be forming two masses. Okay, so this neural crest cell will be splitting into two to form two masses. One is the dorsal mass and the other one is ventral mass. The dorsal mass as well as the ventral mass. This ventral mass is known as sympathochromaffin mass. Okay, so sympathochromaffin mass is the ventral mass of the neural crest cell. This is actually invading our suprarenal gland, and this will result in the formation of medulla of suprarenal gland. So this will be, you can see it here, this is the ventral mass. It is actually invading from the dorsal aspect, isn't it? Dorsal and medial aspect of the suprarenal medulla, and you will be getting the cells here. So these cells are known as chromaffin cells. Chromaffin cells of the suprarenal medulla. So they are actually coming from the neural crest cells, the ventral mass of the neural crest cells, which are known as the sympathochromaffin mass. Okay, so that is how the suprarenal medulla is formed. Now with this knowledge, it is easy to understand the nerve supply of the suprarenal gland. So you know this is the medulla. So what could be the nerve supply? It is sympathochromaffin, right? So the nerve supply is coming from T8 to L1 sympathetic nerves, sympathetic neurons, which are from the celiac plexus. So from this region, the sympathetic nerves will be invading the chromaffin cells. So they are the preganglionic nerves. Okay, so what about the cells of the suprarenal medulla now? The cells of the suprarenal medulla now will be acting as post-ganglionic sympathetic neurons. Okay, so that is how the chromaffin cells will be acting as post-ganglionic sympathetic neurons, because they are invaded by the sympathetic neurons coming from T8 to L1 spinal segments through the celiac plexus, and they will reach here, and so the cells, the chromaffin cells now will be now acting as post-ganglionic sympathetic neurons. So that is the nerve supply of suprarenal medulla. So what about the suprarenal cortex? How are they controlled? They are actually controlled by the pituitary. Okay, so the adenohypophysis. So adenohypophysis will be actually secreting the adrenocorticotropic hormone. Adrenocortico, that means it controls the cortex, and that will be controlling the adrenal cortex. This knowledge is essential because when we deal with the applied aspects, you need to know this aspect. So the adrenal cortex is under the control of pituitary in the form of adrenocorticotropic hormones, whereas the adrenal medulla is actually supplied by the sympathetic neurons, and the cells of the adrenal medulla, that is the chromaffin cells, will be actually acting as the post-ganglionic sympathetic neurons. Now let's discuss about the applied aspects of the defects of the development of suprarenal gland. So we can just discuss about the defects of the adrenal cortex as well as the defects occurring in the adrenal medulla. What are the defects occurring in the adrenal cortex? So adrenal cortex, we know that there are mainly 3 layers for the adrenal cortex. The first one is zona glomerulosa. Zona glomerulosa. So if there is hyperplasia, adrenal hyperplasia for the zona glomerulosa, that will result in a condition known as Conn's syndrome. Conn's syndrome is due to adrenal hypoplasia of this layer, zona glomerulosa, that is the mineralocorticoid layer. And this will actually result with hypertension, mainly hypertension. What will happen if this layer is deficient, if this if zona glomerulosa is not developed, what will happen? It will result in deficiency. So this will be usually due to autoimmune destruction of the zona glomerulosa layer, and that will result in deficiency of this layer, and that condition is known as Addison's syndrome, Addison's disease or Addison syndrome, that is due to a deficiency of the zona glomerulosa layer. So usually the patient will be presenting with pigmentation, and there will be hypotension, muscular weakness, and there will be hypotension. Excess will result in hypertension, whereas deficiency will result in hypotension. Now the next layer is zona fasciculata. Zona fasciculata. What happens if this layer is having a hyperplasia, adrenal hyperplasia occurring in this layer? So zona fasciculata mainly secretes glucocorticoids, isn't it? So that will result in a condition known as Cushing syndrome. So Cushing syndrome usually results with the patient will be having obesity, again there will be hypertension, and there will be hirsutism in case of females. So that is the clinical presentation of a Cushing syndrome. So that is due to excess formation of zona fasciculata layer, that is the glucocorticoid layer. Now what will you get if you have a proliferation of zona reticularis, that is the third layer, the innermost layer, right? So that will result in adrenogenital syndrome. What happens in this condition is there will be excess of androgens, because this layer actually secretes sex steroids, the zona reticularis. So there will be androgen excess, and that will result in adrenogenital syndrome. So in case of males there will be precocious puberty, and in case of females there will be masculinization. So that is what is happening if you get excessive proliferation of the zona reticularis layer. Now, so this is all about the cortex, suprarenal cortex, and coming to medulla. Medulla, what happens? Medulla, if you get a proliferation of the chromaffin cells of medulla, you call it as pheochromocytoma. Pheochromocytoma is a condition where you will get proliferation of the suprarenal medulla. The chromaffin cells will be proliferating and there will be excess secretion of catecholamines, and that will result in paroxysmal hypertension. So that is what you get if you get excessive proliferation of suprarenal medulla. One more point I would like to add here is Cushing syndrome. Usually the reason for Cushing syndrome is said to be a tumor in pituitary. So we have just mentioned that pituitary is controlling the adrenal cortex, right, through adrenocorticotropic hormone. So what will happen if there is a tumor in pituitary? That condition you can call it as pituitary adenoma. So if there is a tumor in pituitary, there will be excessive secretion of adrenocorticotropic hormone, and that will result in Cushing syndrome. That is one of the commonest condition where you get the Cushing syndrome. I would just added that point because you might come across questions related to that. So this is about the developmental abnormalities. Now coming to accessory suprarenal glands. Can you expect suprarenal gland anywhere else other than on top of the kidney? So where else you can expect? You can expect accessory suprarenal glands around the or main suprarenal gland. Around the main suprarenal you might get some of the bits of accessory suprarenal glands. You can expect it in the broad ligament of uterus because all these are somewhere related nearby. Then you can expect it in the spermatic cord of testis. Then you can expect it in the mesentery of gut. We know that this is a dorsal mesentery, isn't it? So instead of confined to this region, it might go and form suprarenal here. So in the mesentery of the gut, then you can also get it in the gastrosplenic ligament and the greater omentum. So all these are ectopic sites or the accessory suprarenal glands, the sites of the accessory suprarenal glands. So just to conclude, you know, the suprarenal glands or adrenal glands are situated on top of the kidney, and they have got two parts, the outer cortex and the inner medulla, and they are derived from two embryonic sources, one the mesoderm and the other one is neuroectoderm from the neural crest cells. Mesoderm actually gives rise to the outer cortex, whereas the neural crest cells or the neuroectoderm will be giving rise to adrenal medulla, and the cortex is under the control of the pituitary as well as medulla, whereas the medulla is actually under the control of the sympathetic neurons. So that's all about suprarenal gland in a nutshell. Please leave your comments if you like this session, and you can give me suggestions on the topics which I have to do in future, and please do share these videos, and those who haven't subscribed yet, please do subscribe so that it will be a motivation for me. Thank you. Thanks for watching.